Hi, I'm Dr. Akana, and I created this video to help you improve your grades, study more efficiently and effectively. So if you are a nursing student in PA school, medical school, or an NP school, then this video is for you. The first study tip that I have for you is to learn the neurotransmitter and the receptor of the drugs that you are learning. Pharmacology is a very difficult subject because students are expected to learn hundreds of medications in a very short amount of time. So by understanding that neurotransmitters and receptors are the keys to drugs, you will be able to study more efficiently, you'll learn your drugs very quickly, because the basic concept is that drugs are designed to either block or stimulate a neurotransmitter, block or stimulate a receptor, or the drug is going to block or stimulate both. The next study tip that I have for you is to read, but do not memorize right away. You want to read your textbook and review your notes. This is often the expression that I get on my students' faces when I tell them to read. But when you're reading, you're actually just getting a quick overview as to what drugs you are learning. And students get overwhelmed because it's so much material, but I can tell you as a professor, it is impossible to test you on every single detail in the chapter. Your time is better spent memorizing very specific things, which brings us to my next study tip, which is memorizing the acronym NURSE Maude. The first letter N in the acronym NURSE Maude is name and class of drug. I like to create charts just like this because it's easier to learn the characteristics about a drug class rather than trying to learn each individual drug. So creating a chart like this, you can do it on your computer, you could put it on a flashcard, and setting it up this way helps you to learn the drug class, and in this case it's the beta blockers. And then also you can list here the subclasses: selective beta blocker, non-selective beta blocker, and you have your mixed alpha and beta. You can see here when you have a nice list like this, you can put all the drugs in the different subclasses and you can learn the drug names much easier. And you can see that beta blockers all end in LOL. U stands for understanding how the drug works. So I have the same chart with the drug class and the subclasses, but now I've added the action of the drug. Action of the drug is really important because when you know where the drug works, so for example, the first subclass is a selective beta blocker. It blocks beta 1 receptors and it's located mostly in the heart. The next drug class or subclass will affect both beta 1 and beta 2. And your mixed alpha and beta blocker is a non-selective alpha 1 and beta 1 blocker, but it also can affect beta 2. So you want to understand, what does all this mean? Where are the receptors and what are the effects of blocking them? And to do this, I like to either draw or have a picture of where the receptors are located. You can see here beta 2 receptors are in the lungs. The effect is vasodilation. So if you block this receptor, you're going to have the opposite effect, which will cause vasoconstriction in the lungs. And I set this up for all the different receptors, and it's just basic information. What organ are you talking about? What receptor are you talking about? And what is the effect of either blocking or stimulating the receptor? If you need a review on where the different receptors are, what happens if you block or stimulate the receptors, you can look at the other videos that I've made that just goes over the most common receptors that are used when in pharmacology. And this will give you a nice, good overview. It'll give you a basic background on pharmacology, which will make it much easier for you to learn your drugs. R stands for reviewing what the drug is used for. So again, we have the same setup with the drug class and name. But now we're going to add what the drug is used for the different subclasses. And this makes it very helpful because you can actually go back through when you're reviewing your notes or before a test, and if there's anything that is different about the drug class. So for example, overall we can see that the beta blockers are used for cardiac indications, but the non-selective propranolol, we can point out here that it's also used for angina, it's also used for anxiety and migraines as well. S stands for side effects, but you can also add side effects, contraindications, or warnings, whatever it is, depending on your program and depending on the level of pharmacology and how much you need to know. S is a good acronym to remember because you can add on, other important points other than side effects. So again, I've set up a chart. So for example, for the beta blockers, it causes bradycardia, hypotension, hyperglycemia, erectile dysfunction, and it may also cause the patient to feel their palms of their hands, and they may have cold feet. So you don't want to list every single side effect. You just want to list a few side effects. Because again, we're not going to test you on every single detail. You just want to have a good, solid foundation about the drug class, and the most common side effects, the most common contraindications, or the most important contraindications that you need to know, and also the warnings about the drug. This is nice to set it up in a chart again form, because when it's time to review, or if you have a lot of times pharmacology final exams or midterms that we give cover huge amounts of material, and a lot of times they're cumulative. So this is a nice way to have your notes or your flashcards organized that you can go back and pick out the particular information that you need to review. E stands for education that you want to tell your patient. So for example, for beta blockers, you want to tell them to monitor their blood pressure and heart rate at home, to hold if their heart rate drops to less than 50 beats per minute, and also to avoid abrupt discontinuation because doing so may cause a heart attack. So these are just a few points that you're going to pull out and put under this section E for education. Again, we're not going to list every single thing. You're going to point out only the biggest points that was discussed in class or the most common things that you need to know about the drug. So that brings us to Maude. M stands for monitoring. So you want to list here the monitoring parameters for all the drugs in the drug class overall. And if you do need to learn a specific indication, so for example, angina, or if you need to learn that we use propranolol for migraine prophylaxis, then you want to list what you want to monitor. So in this case, you would want to know if the migraines got better. So you want to assess how regular and how often and how severe the migraines are. O is for outcomes. So this is basically why we are giving the drug. Is the drug working? And what is the outcome that we're seeing? Is it a reduction in symptoms? Is it the goal to prevent an MI? Is the goal for prevention of a migraine headache? So again, you want to just list specific outcomes of the drug and not list every single detail here. D stands for different or same. So what you want to do from your notes, from your charts that you have already set up, you want to go back and you want to pull out the characteristics that are similar between the drugs and that are different between the drugs. This part is really important. This is where we get a lot of our questions from because we're testing you to see if you can pull the knowledge of comparing and contrasting the drug class that you've learned. And then also we want to compare it to the other drugs and the other drug classes as well. So here the key is to get the biggest key points of the drug class. So in this case, we're looking at same. What are the similar characteristics of the same drugs that belong to the same drug class. So overall, we know an important point for beta blockers is that they all lower blood pressure. And a key thing to remember here is that it causes bradycardia. So we want to hold the medication if the heart rate falls less than 50 beats per minute. Looking at the differences between the drug classes, we want to take a look at what it is used for. So overall, we use it for cardiac indications, but you can see there's some things that are different. Again, for propranolol, migraine prophylaxis, also used for angina, and sometimes used for anxiety as well. So this, we're looking at the difference between the indications of the drugs. You can make little side notes here that you want to avoid certain medications in certain patients. So for an example, a difference here in the subclasses is that if a patient has an indication for a beta blocker, we can still give them a beta blocker, but if they have asthma or COPD, we're actually going to avoid the mixed alpha and beta blocker. The reason is because when we give them a drug that affects multiple receptors and that's non-selective, it can actually cause bronchoconstriction. So we're going to select something that is more selective. And if you remember here, the selective beta blocker targets more of the heart muscles, so we don't have that asthma or COPD exacerbation. And again, I've listed that here so you can make little notes explaining why, just for you to remember and to get a good overall understanding about the drugs. And when it's time for finals or midterms, your little key notes on the side of the charts will save you a lot of time. And you'll find these are a lot of the questions that will be on your exams and even your boards. So again, you want to pull out the very specifics, the important points. Don't try to memorize every single detail about the drug. You want to learn the drug classes, put your charts together, review the acronym nurse Maude, and then go back through and just make little notes about the most important points so that's easier for you to get your notes, review them, and do really well on your exams. If you want to learn more, I will be uploading videos weekly, and these videos will cover all topics found in your pharmacology textbook. Thanks for watching, and I wish you the best of luck.